Hello, health mommies. Hope you all are doing well. Hope your day has been great. Hello. Welcome to our live session for today. Today we are going to be talking about diastasis recti. So I hope some people are going to be joining me soon. And I hope you've had a beautiful day. I couldn't do our live today in the open air because there was a lot of noise out there. So I had to come in here. I would have to do some 1 or 2 tricks for my video to be bright enough. So please permit me for now while we wait for the others to join. Just permit me while I work on my video's quality. Thank you so much for joining. Thank you so much. How you all doing? Hope you all are doing well. Hope your day has been unfolding well. It's weekend and we thank God for life. So I hope you're doing well. We are going to be starting soon. Please give me a minute so that I can do some stuff and then we go on. So today, as I said, we're going to be talking about diastasis recti, and I'm going to be going on to the definition in about some few seconds so that we can talk about this and get it out of our way, because the tummy is one thing which most women are so troubled about. Some don't just feel comfortable about it, and they can't just help the fact that their tummies haven't gone back to the way it was after pregnancy and birth. But today we are going to be talking about one of the main causes of that stubborn belly fat, and we are going to be telling you the ways to prevent it before you get pregnant, and other things which you can do to treat it. This particular condition is not a life-threatening condition, but it plays a lot on the minds of women, because if you feel insecure, you can be confident enough to face other things in life. And also fat which is stored around the abdominal area is linked to a lot of diseases like diabetes, some types of cancer, and a lot of other health issues, even hernia. So we have to try as much as possible to fight this particular thing so that it doesn't cause other issues in our lives and we can live an overall healthy life. So I'm going to be moving on to the definition. I'm trying to do some tricks here to work on my image quality. It works, right? So tell me how you're doing. If you're around, please leave a comment so that I can acknowledge your presence before I go on to the main thing of the day, okay? So thank you for watching. As I always say, if you're watching me from my personal Facebook account, I can't see your comments. So please don't feel like I'm ignoring you. I'm here with you, but I just can't see your comments. Thank you so much for joining, Lady Emefwe Tazisong. Thank you so much. I can see you. Since I have one person around now, I'm going to move on directly to the definition of diastasis recti. This particular condition, it's something really not that complicated, right? But it is something which women struggle with a lot. And most times you see women doing all sorts of exercises because they don't actually know the reason why that belly fat is there. You know, to solve a problem, you have to know the root of that problem. So diastasis recti is just the separation of the abdominal wall. I hope you have a book to jot a thing or two. I always have my book here, so I hope you have yours. So I'm going to put it here so I'm not looking away while talking to you beautiful ladies. Thank you so much, Lady Giselle Itala, for joining. Thank you. Hello. As I said before, this condition is just a separation of the abdominal wall. Now, some research showed that 30 to 60% of women get this condition when they get to about 6 months of pregnancy. And 100% of all the women which this particular research was done on had this condition by the time they were 35 weeks of pregnancy. So it's a really severe condition, though it's not life-threatening, but it is something which can lead to other life-threatening situations. Now, to understand diastasis recti, you have to understand that in your tummy, you have 3 abdominal walls, right? There's the innermost one, which is called the rectus abdominis. There is the middle layer, which are the obliques, and there is the innermost layer, which is called the transverse abdominis. Now, if you look at the way corsets are made recently, let me not say corsets, what they call waist trainers, because that's the name which most of us know, you realize that they are trying to imitate the normal way that the abdominal walls are. So, for example, they make the particular one which really tries to imitate these particular abdominal walls these ones which they have the first layer that you zip up, and then they have these 2 other layers that you bring one forward and clip, and then you bring the other one forward. So they're actually trying to imitate what the abdominal walls actually look like, because it is very, very important to get your abdominal walls back. Now, something which we need to know is that diastasis recti can also happen for men and children. Yes, it can, but the information which is online is very, very limited, and it's not a topic which people talk about a lot of the time. Most times, physical trainers will just see your tummy big, and then they are giving you exercises to reduce your tummy, putting you on diet, of which it can be caused by a particular thing, and the root of that tummy needs to actually be dealt with for you to get a solution. Because if you are trying workouts and you're trying other things, you might not be doing the right workouts for your particular situation, and because of that, you might just be worsening the situation. Hello, Lady Jackie, thank you for joining. Lady Christy Mengot, I can see you, thank you for joining. Lady Mata, thank you so much for joining. Okay, I was talking about the 3 walls of our abdomen inside. The innermost layer, which is the rectus abdominis, the outermost layer, that is the layer which usually really separates. And if you saw the image that I put before I started the live, or the image which I circulated around for our live session of today, you realize that there is a space in between your muscles in your tummy. In normal tummy, the muscles are almost tied together. There's just a very little space in between, but for a tummy which has diastasis recti, there is some really big space in the middle of it. So the rectus abdominis is what really shows that space from outside, right? That is what we can see from the image which was circulated about this particular live session of today. Now there is the innermost layer, which is the obliques. Now, how does the obliques function? I'm sure you must have seen this type of waist trainer which has the first layer, which maybe you can zip together, and then it has 2 more layers on top. So the oblique is like that, those 2 more layers which comes from the back, and then it clips on top, and another one comes from the back and clips on top of here. So it's like the middle layer in your abdomen. Now the innermost layer is like a corset, right? It's like that. When you look at the waist trainer I'm talking about, I cannot put a picture here because if I go to put a picture, you might not be getting my voice anymore. So if you look at this particular corset or waist trainer which I'm talking about, it has 2 layers or 3, but the second layers are doing the same work. So the first layer is to hold your tummy in, and then you can zip it up or clip it, and then it has 2 more layers which are on top. But those layers are acting like the oblique, which is your middle layer of your abdomen. So with that said, I'm going to go on to talk about some of the symptoms of diastasis recti. It is very, very common, as I said before. About 80% of women have it after they give birth. So that explains why you can see most of our mothers had big tummies. And most women, even us who were slim before getting pregnant, after giving birth, though our tummies have gone back to a certain level, but you realize that your tummy cannot be as flat as it was, which is because of this separation in your abdomen. Because for your baby to sit in there, your abdomen really enlarges, and then your muscles have to open as well. So I'm going to talk about the symptoms. The symptoms are generally a bulge or purge in your stomach, like the big tummy that we'll normally see from outside. A general feeling of weakness on your abdomen, like maybe things I used to carry before and feel very comfortable when you were maybe much younger. You carry them now and you feel like you're stressing your body too much. Another symptom is lower back pain, which can be associated with many other things, but lower back pain is one symptom of diastasis recti. Now, another symptom when diastasis recti is very severe is pelvic floor dysfunction. Now, what's the pelvic floor? The pelvic floor is just this lower part of your tummy, right down. And for some women, when women give birth a lot, they usually feel something which it happens like maybe you can't hold pee anymore. Like you feel like when pee is coming, it's just going to come out because your pelvics are weak, right? So it might lead to pelvis dysfunction when diastasis recti is very severe, and also it might lead to pelvic pain. One very huge complication which can happen as a result of very severe diastasis recti is hernia. It is usually associated with diastasis recti because when your abdominal muscles are weak, it can give rise to hernia, but not in every case. As I said before, it is only when it is extremely severe. Now, I've been saying a lot about this, and I'm sure you should be wondering, how can it be diagnosed? So I'm going to explain a little simple way which you can do it right now. You can do it within 30 seconds. I think I'm going to give 30 seconds for you to go down and do it if you're in a position where you can do it. All you need is maybe just the floor, a clean floor, because if you are at home and maybe you're out there and the floor is not clean, then you can't do it. So a simple way to do it is with 3 steps. You just lie down, you take your legs up, like your knees, you take your knees up and make sure that your feet are on the floor. I don't have a bed here, so I cannot do it, but I don't know how I can do it, but I hope you understand my explanation. If you don't understand, just let me know. I'll try to explain it in another way so you get it. So it's like you're sleeping on the bed flat, and then you take your knees up. Your legs are not straight up. Your knees are lifted up, but your feet are down, right? And then you do as if you're lifting your neck, lift your neck a little, as if you want to do a crunch, right? The position which you are before you start doing the crunches, if you know how to do crunches anyways. But you lift your knees up, your feet are still on the floor or on the bed, and then you lift your head up. While you're trying to lift your head up, you put your hand on your tummy. It can be tested. You can check it in 3 places. You either put your hand on top of your belly button, or you put it under your belly button. If when you raise your head, you feel a gap in that particular point where you put your hand like this in that particular place. You feel something like a gap, or it's maybe soft, and you feel your hand dipping inside, then you have diastasis recti. That's the simplest way to check it. But if you are overweight, then you might not be able to check it that way, because the extra fat on your body might make it in a way that it will not be so visible, or you'll not be able to feel it. So if you're overweight, you need to do maybe an ultrasound or an x-ray, which will show it. Yeah, so that's the simple way to do it. You lie on the floor with your back flat on the floor, you lift your knees up, and then you put your hand either above or below your belly button, and you lift your head, just your head, not your shoulder, right? You lift your head so that you're straining the abdominal walls, and you'll feel if you have a gap in the middle. So that is a simple way to check it. I'm going to give you 30 seconds to go down now and check it, and tell me what you realized. Is it normal? Did you feel that is normal there, or you felt that maybe there was a space there? And if I realize there are mothers here who have it, we are going to talk more, and you're going to get a simple way to solve it. It is not a life-threatening situation, as I said before, but women's tummy is one thing that gives them a lot of stress. Okay. Thank you so much, Lady Tazson, for your comments and for trying it. Yeah. So let's go on. I hope the other ladies can try it. It is very, very common, especially I'm going to say the causes, and you're going to realize if you actually felt that hole, why you have it, right? It is not a life-threatening situation, but it is something which can lead to other situations if it is left untaken care of. So as I said before, Lady Giselle, you lie on your back, flat on the floor, and then take your knees up. You take your knees up, right, with your feet still on the floor like that. You take your knees up, and then while you're flat on the floor, you put your hand above your belly button, above your navel, and then you lift your head up a little, just your head, not your shoulders. Make sure that you're still on the floor. Lift your head a little, and as you strain your wall, as you strain your belly wall, you realize that you have a hole, if you do have it. So you can check it above or below. So you lie on the floor. Let me try to get something that can bend. Okay, say this is you lying on the floor, right? This is your, good, this paper is really, really nice because it has a surface for the knee. Okay, let me do this now. I hope I can illustrate it here and you can get if you're doing it right or not. So this is your back, from your butt to your back to your shoulder. And then you lift your knees up like this with your legs still down. Are you seeing what I'm trying to do? I hope you are getting it. I don't have a bed here, I can't lie. So I just have to. But after this session, I'm going to try to do a video. I hope I have good lighting. I'm going to try to do a very short video on how to check it. And I'll send it to our page maybe today, tomorrow, or latest Monday, so that you ladies can actually see how to check it. But it is very, very easy to check. So you lie on your back, you raise your knees up with your legs, with your feet still on the ground. Okay, that's great. That's great. Some women don't have it. For women who normally had normal size, they can get pregnant, and if your tummy did not get so big, you won't have it. So it's very normal. It's okay if you don't have it, thank God for you, but there are things which you have to do to prevent it, okay? Oh, I forgot to tell you ladies, please share this video, because there are so many women out there struggling with belly fat, and then they are doing all kinds of exercises and they are complaining that their tummy is not going down, they can't see their abs anymore. So please share the video so that other women like you can see the video, and it can help us reach more women out there and solve this particular situation and get women to be more confident, and also help them to prevent other diseases which are related to abdominal fat. So now let's talk about the causes. And from talking about the causes, you get to realize why you have it or why you don't have it. Now, excessive pressure, the first cause is excessive pressure on the abdominal wall, either from pregnancy or rapid weight loss. Or rapid weight gain, or rapid weight gain. So I'm going to take that again. Lady Martha, please don't tell me that you were doing it. Like, are you for real? You can't be serious. Seriously, I can't take this. Like, you actually went down to try. Anyways, it's good you did, and it's good you got you got a result. Okay, as I was saying, the first cause is excessive pressure on the abdominal wall from either pregnancy or rapid weight gain. Now, the second cause is babies who are born premature can have it because the abdominal walls, the abdominal muscles are not yet fully formed. So as they grow, it's going to form up and it's going to close naturally for babies who are born prematurely who have it. Now, another cause is your size as a woman. For women, if you're a petite woman, like you're small or you're really slim, after pregnancy, you are more likely to have it. For example, I did it and it shows I have it. because normally my tummy was really small and my sides were really small. I remember when I was in school, at some point there was a guy in school who always used to provoke me, because there was a day he sent his hand around my waist. Like, my friends were sitting with him and they were saying my waist is so small, so he sent his hand around my waist and he actually went round. And you can imagine how small my waist was then. And even before I got pregnant, I was still really that tiny. So women who are too slim or petite women are women who have a certain, they are really small in size, right? Women who are really slim or petite size women are more likely to have it. Yes. So another thing which is a cause is multiple birth. So you look at my situation, a lot of things normally put me at risk of having it, like having multiple birth as maybe your first pregnancy, when it's the first time your tummy is stretching and then your tummy has to stretch times 2. So multiple pregnancy also puts women at risk of having diastasis recti. Also, giving birth multiple times, like giving birth to 4 children, you might not have it in the first one. Like the other day, a mother on a Nyango WhatsApp group was saying when she had her first child, she didn't do anything for her tummy to go down. But in the second one, the way her tummy is, she's afraid that her tummy might never go down. So the first time you have pregnancy, your abdominal walls might still be very strong. So even though they pull, by the time you give birth, they come back normally. But now, in the second pregnancy, due to the fact that they have pulled before, when they pull again, it's like having an elastic, and you keep pulling it, and you're pulling it, and you're pulling it, it weakens. That is exactly what happens in there. So if you have given birth more than once, you've gotten pregnant more than once, you stand a high risk of getting it. It can cause it as well. Also, a sway back posture, when you're standing or when you're sitting, people who normally walk and they're like this, the pregnancy position, because of the weight in front of you, usually makes you to push your back, to push yourself in front. So if you are normally in that kind of way that you're pushing yourself in front, you are more likely it can cause diastasis recti. So let's try to be in the right posture. Let's try to just do what we can do. But sometimes you might just have it. For women who have normal size, right, you might not have it because your body size is already normal and maybe you have some weight on your body and maybe your sides are not so small. Because when you get pregnant too, as your tummy gets bigger, your ribs also enlarge, right, for your tummy to be able to carry that baby. So you can imagine for a petite person how much to expand for her baby to be able to sit in her tummy. So those are some of the causes. Now, we are going to talk about treatments. As I said before, this is not a life-threatening issue, but if you can treat it, then work hard to treat it, because it's going to leave you safe from other diseases which are associated with fat around the abdominal area. Because if your abdominal muscles are already weak, then you can easily carry fat in that particular area, because it makes your tummy to normally appear bigger. It makes your sides to appear bigger than they are normally supposed to be, because there is that opening, there's that separation in the middle. So let's go on now to talk about the treatments. Now, for treatments, one thing which you should do, there are simple things which you can do to fix this particular thing. So avoid lifting heavy objects which might further strain, because it's when you strain your abdominal wall too much that it begins to separate, right? When there's a lot of strain, pregnancy strains the abdominal walls a lot. That is why there is that separation, especially for women after pregnancy. So avoid lifting heavy things. So you see a situation where maybe you have a large tummy and you go to the gym and they are telling you to lift weights, you might just be worsening the whole situation, because you're straining the outermost layer of your abdomen, which you should be trying not to strain it as much. Okay, another thing that you can do is to practice good posture. Just by practicing good posture, you can fix your diastasis recti. Another thing which you can do is, by preventing you from straining your abdominal wall, there are things that we do every day which makes us strain our walls. abdominal walls. Like when you want to wake up, you're lying like this and you just go like this. You're straining your walls somehow. So it's better that when you want to wake up, you turn to your side and then you wake up, you turn to your side, turn your leg down, and then you wake up gently so that you don't strain your walls so much. Now, another thing which you can do is exercise. So normally the Diastasis Recti can correct itself for a lady who got pregnant and after, within 8 weeks after pregnancy. But if after pregnancy, after 8 weeks, after 8 weeks of delivery, you realize that you still have it, then you have to start trying exercises to strengthen your abdominal muscles so that they can come back together and be as firm as they were before. Also, I would like to say that it is also recommended sometimes when it is very, very severe, because normally the opening can be within 1 to 2 centimeters wide and between 15 to 16 centimeters long, depending on how tall you are as a woman. So if maybe it's too wide, more than 2 centimeters long, they usually recommend a surgery, because that is a severe case of Diastasis Recti. Those are the kind of situations, the kind of cases that can cause hernia and other things. So that's what you need to know. That another form of treatment is surgery. They usually do surgery to correct it as well when it is very, very severe, or when you've done exercise for up to 6 months to a year consistently, like every day, and you don't see any results, then a surgery is recommended. Now, you can also prevent Diastasis Recti with exercise. So before you get pregnant or while you're pregnant, you can do some mild exercises to help you prevent it. Before you get pregnant, you can do abdominal exercises to further strengthen your abdominal wall, so that in case it needs to stretch, it'll be easier for it to come back. It's like, for example, you take their elastic which are weaker and the elastic which are stronger. If you take an elastic which is very, very strong, no matter how you pull it out, as in it's going to be extremely difficult for you to even succeed to pull it so much out because it is very strong. But if you get a weak elastic and you try to pull it out, it can extend, it can pull so much, and then for it to come back, it gets weakened. So that's just what you want to do. If you have not yet gotten pregnant, you try exercise to further strengthen your abdominal wall so that you can prevent Diastasis Recti. Now, since we've talked about the treatment, we've talked about what you can do to prevent it if you don't have it yet, somebody will be thinking, so what are the exercises? I'm going to list some very few exercises here which you can do to strengthen your abdominal walls, particular abdominal walls. And on your own free time, you can go online and do some research, because on our live sessions, we can't really tell you everything. So it's left for you. If you know you have it, or you feel like, okay, I need to strengthen my abdominal wall, which obviously you need to. If you've not yet given birth, you are on a very good place to start strengthening your abdominal wall. I wish I knew this before I got pregnant. I would have started some exercise. So if you want to do this, you can further go online and check about it. A good site which you can check is TummyTeam.com. You can check TummyTeam.com. You'll see some good exercises there to prevent Diastasis Recti and to strengthen your abdominal wall. So that's one site which I found some really good information there, though most of their courses are paid for. So I'm just going to list the exercises. I'm going to try, when I send the short video on how to check Diastasis Recti, I'm going to attach these exercises, samples of these exercises, which obviously means I might not be able to do it today. So I'll do it tomorrow, and I'm going to send them to our page on Monday, since we don't normally work on Inyango on Saturdays, and we don't usually work on Sundays too. We want our mommies to have family time. So some of the exercises which you can do to prevent or strengthen your abdominal walls. The first one is to strengthen your transverse abdominis muscle, which is the innermost, the one which is inside. Because you know, if you start strengthening what is inside, then the one outside can take shape. But if you go on and start strengthening the one inside, when the outermost one, when the ones right inside are not strong, then you might not get a very lasting result. So the first two exercises I'm going to talk about are to strengthen the innermost layer of muscles. So it is actually called, hi Lady Vera, thank you so much for joining. Diaphragmatic breathing technique. Diaphragmatic breathing technique. It's actually spelled APAGMATIC if you wish to search it. It is spelled DIAPHAGMATIC, breathing at the end. So this breathing technique focuses when you're doing this breathing technique, you have to focus on enlarging your rib cage, or expanding your rib cage while you're doing the technique. So it's like you're breathing out and then you breathe in while sitting on the floor. As I said before, I'm going to send all these exercises on Monday on a post, how to check for Diastasis Recti, and these few exercises, I'll try to put them on one particular post so that you can see it all together. Yes, Lady Martha's tummy is flat, but she needs to prepare her abdominal walls so that she doesn't get Diastasis Recti, because she's small, she's really, really slim down there. So with pregnancy, she can really open up. So she needs to find a way to strengthen abdominal wall now before she gets to pregnancy. So she has the right timing. So be here, take your exercises please and start doing them so that you save yourself for later worries. So I was talking about the diaphragmatic breathing technique. That's the first exercise which can help you. It's really, really simple. You might not even feel like you're exercising, but it works magic. Now the next exercise which you can do is the posterior pelvic tilt. This one, you're lying on your back, like you're lying when you're trying to check for Diastasis Recti, and you're still doing the breathe out, breathe in, breathe out, breathe in. And you try for your back to get as flat as possible when you're coming back down. Because when you breathe out, yes, Lady Jackie, that's the spelling. When you breathe out, your back is going to get a little deep up. And when you breathe back in, try to get as flat on your back as possible. So those are two exercises to strengthen, your transverse abdominis muscle, which is the innermost muscle in your tummy, which acts as a corset, which holds all the other things inside before the other two muscles outside are holding it up. So another thing which you want to do is to strengthen your oblique. Your oblique is that middle layer, right? Like when I'm talking about the example of the corset, which has the one which is inside that you can zip, and then the two ones which you can put on top. The oblique is an example of the two ones which go on top. So this exercise is to strengthen your oblique. They are called modified side plank. Side plank is pretty simple. You go down like you're lying on your side, but your elbow is on the floor, lifting you up, and you try to get in a straight position, right? You can just search it online, modified side plank. It is very good for strengthening your oblique. Also, modified mountain climbers, which are mountain climbers that you don't actually go down to do them. You do them while standing and on the wall. So you're just lifting by your legs. The action is actually walking mostly on your legs, but your hands are on the wall stable. So try to search these exercises and try them out. Now, something which you should avoid doing if you don't already have Diastasis Recti or you have it is to avoid lifting heavy objects. There are also lots of exercises which you have to avoid, but I'll leave that for you to go and do your research, and you'll get a lot of information online. This right here is just to create some awareness among mothers so that they can go ahead and do research and empower themselves with wisdom, right? Because I can't tell you everything here. Sometimes I'll deliberately not tell you everything so that you can go out there and read for yourself, empower yourself with the information, and help some other mothers out there. So there is one thing which I did not mention for the treatments. As we understand, when you have diastasis recti, your tummy normally protrudes outside. Your tummy is normally big because of the fact that your muscles have become open. One thing which you can do, this is the reason why I love waist trainers, but you mustn't go for the one which is too tight. No, go for maybe one size lower than your normal size so that you can hold in your muscles. So there are some other ones which they call belly bands, but as around here, I hear women call everything that holds the tummy waist trainers. Even corsets, they call it waist trainers. So the belly band, anything that holds your tummy inside and takes it inside is good. But don't wear the one which is too tight or it is too uncomfortable. You can even wear shapers, body shapers that help to hold your body inside. Just get a size which is one size lower or two size. If you're using a body shaper, get a size which is 2 sizes lower than your normal size. It can also help to take those muscles inside. Keep them in one place, and with exercise, you will see great results. So I've actually elapsed everything I wanted to say today on Diastasis Recti. So I'm going to ask for your questions. If you have any questions, please drop your questions and I'll be delighted to answer and help you walk this journey of solving Diastasis Recti. As I said before, if you have it, don't get so worried. It's not a life-threatening issue. It can be solved very easily, except when it is extremely severe. But no matter what you do, if you realize that you have it, I would like to advise that you seek advice, further advice from your doctor or from your physiotherapist. I'm only giving all of this advice here and went out to look for exercises because I know in Africa where we are, we don't usually have professional physiotherapists, or it's not that easy to find them, even if you have one around. So ask your doctor, talk about it with your doctor so they can give you some more advice on what you can do, because there is no drug out there to cure it. So are there any questions? I hope there are not some people watching me from my personal Facebook account, because if you're watching me there and you drop a question, I'm not going to see it because I'm broadcasting this live. I'm broadcasting it directly from our Inyango Facebook page. So if you're watching from my Facebook account, I won't be able to see you. I won't be able to see your comments. So please, if you're watching from there and you have a question, I would maybe suggest that you move to our Nyango Facebook page and ask your questions so I can answer your questions. Please, if you have any questions, drop them. I have just about 2 minutes more here, so I can answer your questions, and then we can move on to our normal lives and go on with the things we have to do. So if you have any questions, I'll be delighted to answer. Any questions? Let me just acknowledge those who were here so that it saves me some time while I'm waiting for your questions. Thank you so much, Lady Jackie, for joining. Thank you so much for all the comments. Thank you so much, Lady Vera, for joining. Thank you so much, Lady Mata Camera. Everybody loves that name. Thank you so much, Lady Tazi Song, for joining. Thank you so much. Who else was here? Lady Giselle Itala for joining. Itale, sorry if I pronounced it wrongly. Lady Giselle Itale, I guess. Thank you so much, Lady Christine Mengot, for joining. Thank you all, ladies, for joining. Please don't forget to share the live, because it might be of help to someone out there. There might just be someone who has taken all kinds of diets and is doing all kinds of exercise but cannot see results, and they are looking for a video like this to help them. This question, Lady Jackie says, each time I do intense abdominal exercise, I feel pain under my belly button. Don't know why. It just depends on your body, and I feel that you should consult about it. Though yes, when you're doing abdominal exercises, it's normal for you to feel pain on your tummy. Like you feel those muscles. Most times you have to feel the muscles, not really, except if you're doing an exercise which targets your lower abdomen. That is when you can maybe feel pain there, right? that is when you can feel pain there. So if you're doing normal exercises, that is why it is very important that before you do an exercise, you do research about it, right? So that you know what you're doing. You know the muscles which that exercise is targeting. So that maybe you're not doing something for muscles which you're not trying to train, and then you're getting some kind of effect, okay? So maybe you check the particular kind of exercises that when you do, you get that pain, and then you go on and do some research on what those exercises are meant for, the muscles which those exercises are supposed to strengthen. And if you realize that it is the muscles of the lower abdomen, then maybe that's why it's causing the pain, which normally shouldn't last so long, right? Because after exercise, after a day or two of exercising, your muscles are supposed to normally heal. That is why maybe you're supposed to not do so much exercise. Yes, exercise is good, but you can't do abdominal exercise every day of the week because you'll be straining those muscles too much. So you can do it 4 to 5 times to 6 times in a week. Maybe you have one day to rest if you are actually really wanting to train that particular muscle. So I hope I answered your question. Just do more research. First, maybe you try your exercises, your abdominal exercises which you used to do, and see the ones which actually cause that particular pain. Yeah, so it means it's not anything to worry about, but I'll still advise that you check with your doctor and you try to check the particular exercises which cause that pain and the reason why they might be causing that pain, like by searching the particular muscles that those particular exercises are meant to work on. So I guess that was the only question I had for today. Lady Vera says thank you. Lady Giselle says thank you for always educating us. Waiting for the video to check it. Yeah, I will definitely send the video. Lady Jackie says yeah, after some hours. Yes, I saw that. Okay, thank you all so much. It's going to be goodbye from me. Hope you have a great evening. Hope your families and your babies are doing well. May God bless you all and help you as you target your Diastasis Recti if you have it. And if you don't have it, I pray that it stays that way and you can incorporate more exercises to strengthen your muscles, your abdominal muscles, so that you can prevent it. Do have a beautiful, beautiful day and may God bless you all. Bye.